Hello, Wellness Companions. This is AJ Webb, your San Luis Valley Health Wellness Coordinator, and I have an episode of this wellness show that will lift you out of your chairs and help you think about the ways that you are exercising, the ways that you are moving around the world. I got to sit down with Dr. Corrie Jones, who is a physical therapist and a team lead here at SLV Health, and I got to ask her about the things that we can do in order to keep ourselves healthy and moving towards our goals. Injuries are a bummer. There's no doubt about it. I've experienced injuries as a college athlete, and anything that derails you from exercising and getting yourself into a place that you can perform the way that you want to perform is a bummer. And it's a double bummer if it's because you could have done something, if it's preventable. And there's some low-hanging fruit that Corrie and I talked about in regards to supplementing your workout regimen so that you are going to be less likely to get injured. Corrie is no stranger to movement. She's no stranger to injury herself. She spent an undergraduate and a college athlete career at Messiah College, go Falcons, where she experienced some injuries, and she was around some folks, some great therapists that inspired her to study physical therapy. And now she gets to help out folks on a day-to-day basis solve their movement problems. And she's coming from a first-hand experience where she had experienced ACL tears, shoulder dislocations, and numerous other injuries. Things that we talked about are what does the process of getting into physical therapy look like? Do you need to talk to your doctor? How does all that work? And some of the things that she does in order to assess you and help you get back to whatever it is that you're doing so you can get back to living your life ideally pain-free and as functional as possible. We talked about warming up before exercise, what you should do, what are the main components. We talked about cooling down. We talked about what are some of the things during your regular workday if you are bound to a desk, so to speak. What are some of the things that you can do to help yourself out when you do go to exercise? We wrap everything up with a fireball round where I take out some mobility torture devices like lacrosse balls and rolling pins and these different things that I've used in order to take care of myself and my tissues and my own mobility, and had Dr. Corrie Jones tell us a little bit about those things. It's a fabulous conversation. If you like this if you like this information, you like these videos, what I want you to do is I want you to subscribe to the YouTube channel. I want you to share these videos with your friends. I want you to leave comments, and I want you to share this information so it can show support to continue to sit down with experts and we can leverage their knowledge, skills, and wisdom so that we can become more well ourselves. So, without further ado, Dr. Corrie Jones. Disclaimer. Do not use this information as medical advice. Instead, see your own family doctor for care. The opinions expressed do not represent the opinions of SLV Health. Dr. Corrie Jones, welcome to my Wellness Cape. How's it going?
It's going well.
Super. Thank you for joining me. I'm excited to talk to you because you and I have gotten to lift some weights together, and we've had a lot of discussions about movement, and I'm hoping that we can take some of the low-hanging fruit that's out there for people so that they can better understand about movement, about how to keep themselves healthy. But let's start out. Can you tell me what is your title here at SLV Health, and what do you do on a regular basis?
I'm a doctor of physical therapy, and I'm team lead, so I kind of head up as far as helping out all of our team to stick together and kind of coordinate everything. On a daily basis, I'm in the outpatient clinic here, so working on patients who have had injuries or surgeries or any kind of pain that we're trying to correct. And then I'm also an assistant soccer coach over at Adams State University.
Awesome.
And then I also work in the Adams State athletic training room 2 times a week to help out with the athletic trainers there.
Awesome. Sounds like you need some things to keep you busy.
Yeah, exactly.
Yeah. Corrie, where did you study physical therapy?
I'm at the University of Maryland School of Medicine, so that's in Baltimore.
And what did you get? Did you get an undergraduate degree and then go and study that?
Yeah, so it's a 4-year undergraduate, which I did at Messiah College. So I played soccer there. We won a national championship and went to 4 Final Fours, so it was really fun. So that was undergrad, and then, doctoral school is 3 years post-grad. So.
Okay, awesome. Well, congratulations, champ.
Thanks.
That's super special. So you've been around movement, a lot. So did you play soccer your whole life? What did that look like for you?
Yeah, I played soccer from 5 years old on, so I've been playing, forever. This is the first place I've lived that I don't play, actually. Wow. So I even played post-grad and stuff too. But yeah, so I love sports, enjoy sports. I'm a big sports fan, so yeah, always watching different sports on TV and stuff. So not only soccer, but. Did
your involvement in sport, was that one of the things that led you to become a physical therapist?
Oh, for sure. I had a ton of injuries.
Yeah.
I mean, I don't even want to go down through the list for you, but I had some good rehab specialists and some poor ones.
Uh-huh.
And so once I kind of got to see the amount of time they get to spend with people, the influence they have on people, I really wanted to be one of those good rehab specialists. So,
awesome.
Yeah.
Awesome. I know you said you don't want to go down the line. You got a lot of them, but what were your did you have a big three? Don't count the repeats.
Yeah, my big three that I actually needed rehab was left knee ACL tear, right knee ACL tear, and then right shoulder dislocations. So yeah, those are the big guys.
Wow. And so during did you play 4 years? Did you have a redshirt year in there? Did that affect your eligibility? How'd that work?
Yeah, I played 4 years straight through.
Wow.
My second ACL was junior year, and I had played too many games to redshirt. So I just missed out. Yeah, so basically we went to the Final Four again that year. We got to the final game, and so I got to watch and encourage instead of playing. So it was hard, but again, it made me more devoted to get stronger so that it didn't happen again.
Right.
Senior year.
In the work that you and I have done together at the injury prevention clinics, when we talk about injury prevention, that's not particularly like what's everyone, on people's minds. As Kelly Starrett says, it's like people are just all about performance, right? Mm-hmm. So when we start to think about injury prevention, really what we're doing is we're setting ourselves up to be successful, to achieve the goals that we have, right? That it's part of being a champion. It's part of, being able to stay with whatever program or whatever it is you're doing. But anyway, so it kind of, the injury prevention components, they kind of get kicked to the side, which is a bummer. And it's especially a bummer if you wind up injured because of it.
Right.
Let's talk about what you told me a little bit about what you do on a regular basis, but what is a typical visit to a physical therapist like, and how does someone wind up coming to see yourself? What's the process?
Well, in the state of Colorado, there's direct access, which means you don't need any doctor script to come to physical therapy.
Okay.
So if you have pain, aches, pains, whatever, you can come directly to us and say, hey, I want an appointment. The only thing in doing it that way is that usually you're paying out of pocket. So you're paying whatever services we give you, you have to pay for it that day.
Mm-hmm.
If you want your insurance to cover it, then generally you need to go to a doctor first. So whether that's an orthopedic surgeon or whether that's just your primary care physician, you're getting a script from them just like you would a script for medication, and you bring it to our office, and then they set you up with physical therapy from there.
I see. So I'm injured, or I think I'm injured, and I go and I say, hey, doc, whether that's my primary care provider, or a specialist, and then they would say, hey, it's probably a good idea that you go see Dr. Corrie Jones.
Right.
Gotcha.
Yep.
So let's imagine whether I'm paying for it out of pocket myself, or I'm being referred to you by a specialist or by my primary care provider. What happens next? What happens as soon as I show up to your office door?
So the first thing is there's an evaluation process. So that's the first day. We call it an initial exam. Basically, we are doing our diagnostics. We're trying to see why you have pain. Lots of people might get like a theory from their doctor, but because we're movement specialists and rehab specialists, we kind of come up with our more specific diagnosis for you. So the doctor's script might say knee pain, whereas we might go in and say you're having knee pain because of A, B, and C. So we kind of try to basically diagnose and figure out why it is that you're having the pain. So we'll look head to toe to find out what it is within your body that's compensatory making you have that pain.
I see. So will that be a mix of like watching you move and then kind of, I remember being, push down on this and lift up and those kinds of things?
Yeah. So watching you move, doing functional things every day that make you hurt. We're going to see why the movement's making you hurt. Maybe we'll see things that aren't quite right. And then, strength testing, mobility testing, trying to see if you have the coordination you need in order to do the motions. And then sometimes more particular things like that. We work with vertigo patients. We work with stroke patients where we'd have to test sensation. So a bunch of different more specialities that we'd have to actually diagnose further too with different testing.
I see. So you said the doc or the person referring you, they may have a theory or an idea about what's going on. I bet you the folks that come in, they might have some theories or some ideas about what's going on too.
Yeah.
What is helpful for you as a physical therapist to hear from me, the patient? Because me being someone that's familiar with movement, I could come in with a whole bunch of ideas and speculations, and I read this book and I saw this article and a bunch of stuff like that. What's the information that's going to help you help me?
Yeah, the biggest thing we tell people is pay attention to when it hurts. Okay. When does it bother you? So morning, evening, is it after you work out or is it when you're working out?
Okay.
Is it something that is like, what type of pain is it? Sharp, dull, that kind of thing. So the better you know your pain, even where it is. Sometimes we ask people, well, where's your pain? And they're like, kind of global around here. If you can pinpoint with one finger.
Global meaning just kind of like all over the place?
Right. Okay. So the more specific you can be about what type of pain it is, when you get it, and what activities bother it, that helps us with our diagnosis in a big way.
So a good, helpful statement is, it hurts right here, right by my kneecap, just off to this side. It does that it feels that way when I squat, but it doesn't feel it when I'm doing it. It is afterwards.
Right.
So this is helpful information.
Right. And it's a sharp pain, not a dull pain, or it's pinchy.
Oh, okay.
Yeah.
Okay. So that even helps me, because while as helpful as I'd like to be, I could be either confusing you or confusing myself. Definitely confusing myself when I'm trying to describe what's going on. So we have a lot of folks that'll be starting a new workout regimen in 2018, and we'll be either getting back into the gym after not being in the gym, or they're amping it up. And it's been my experience that these are times where because we're amplifying either our efforts, our frequency, our loads, whatever it is, we're a little bit more susceptible to injury. Can we talk a little bit about what are the causes of injury?
So there's three main causes for injuries. So one is mobility, one is stability, and one is neuromotor control. So usually it's a combination of those three, but those three things are what you need to move well.
I gotcha.
So
can we unpack those real quick? Right. So what was the first one?
Mobility is the first one.
So mobility, and that would be range of motion?
Yeah, so range of motion or muscle tension, or even like what you would get from your ortho or your physician is maybe an MRI that says something structurally is wrong. So I don't have the range of motion in my knee because I have a meniscus tear, or I can't move my shoulder because of a labral tear. So something that's limiting range structurally. And
you have standards as far as something like hip flexion, like how far if I'm standing up, how far my kneecap should be away from there. You have like this angle. So you have some standards on, generally speaking, where should people be at for the mobility?
Right.
Or, excuse me, for the mobility, right?
Mobility,
for the mobility part. Yep. And then, so you said mobility and then stability. So is that how long I can stay in one particular position? What would you describe stability as?
That's part of it. So stability is strength. So how well you can actually stabilize a joint. So if it's real loosey-goosey, you imagine like a hinge on a door. If the bolts come in loose a little bit, the door sometimes will fit in the door frame, but sometimes it won't. It's going to kind of hit the sides or whatever. But if you tighten up that bolt and make it stable, then the door is going to fit in the door frame every time.
I see.
Same with joints. So throughout your body.
So like that test where it's like you're pushing down on my hand, I'm supposed to resist you, and if you're able to just floor me right away, you can see that there's a stability issue.
Right. Yep. And even we can see that a little bit too in how you move. So if your body, is doing certain things while you're moving, if it cannot hold you up, can't hold your body weight, or if you're lifting something and you're compensating, then we can tell that it's a stability issue.
Gotcha. Yep. And then the last one, you said neuromuscular control. So that's my ability to make my software tell my hardware what to do?
You got it. Yep.
Okay.
What the brain's telling the body to do.
Right. And even though I might think that I'm I'm doing something, I could be doing it in a way that's, structurally unsound, mechanically broken, so to speak. So, because I remember doing this where we were doing the functional movement screening, and you were having me lift my leg up and step over something, I think. And instead of just lifting my leg, my kneecap coming straight up and down, I was twisting and turning and kind of getting this flat leg thing, because that was how I could get myself over that, and that was like the pattern that I had built for myself.
Right.
But it's an indicator to you that I may not have the range of motion that I need, and I may not have the software hardware connection to properly move in that plane. Is that right?
So even if you have the mobility and the stability to do the motion, like you said, your brain has created a pattern that's not the most efficient pattern. Okay. So using the mobility you have and the stability you have, can we have you do that in a different way or a different pattern? And then that's corrective. So it's not necessarily saying you have a mobility or stability issue, but your brain does not know how to activate the joints or the muscles correctly. So we see a lot of times people can do a motion, but they're not using particular muscles that would help them do it more efficiently. So that's the brain's role. Can we make it the most efficient? And it's funny, they've done all kinds of studies on neuromotor training, and you cannot change neuromotor patterns. They're there forever. They've cut a guy's brain in half, and he still was able to play the piano. Right. So they're able to do. Your brain maintains these patterns, but so we can't change them, but we can give you new patterns.
Build new ones.
So you can't teach old dogs new tricks is false. That is not true in any way, shape, or form.
You just can't erase the old ones.
Yeah, exactly. You can then, I tell people it's like a library, so you can pull this book out every time, this is the movement pattern I want to use, or we can give you another book and say, leave that one on the shelf, I want you to pick this book out every time, so that now you're using a more correct, more efficient movement pattern to do the things that you're doing so that you can avoid pain.
Got it. And ideally you start to practice and adopt that new, healthier movement pattern. And so when things get difficult or things are heavy, that you're defaulting to a higher quality movement pattern.
Exactly.
That's the whole idea around like a movement practice, right? Is that you want to use the highest quality, movement that you can as often as you can.
Right.
So those are three things that we just unpacked right there, and you talked about the injury cause being typically one of those three things, and it's you to vet it out and figure it out,
or a combination.
So one of the words that I heard you say in there was activate, and when you say that, I think about a warm up. So as an athlete that played NCAA sports too, I've been through bajillions of warm-ups before weights, before running, before practice, before games, in the middle of games, all these different things. And it's always been kind of just this thing you did. So it's always been something that I've always done. And I was quick to blow it off as soon as possible when I didn't have that coach structuring me into it. And I feel that's had some consequences for me. But I was able to just make a decision, hey, I need a warm-up, and I'll just copy this warm-up that I've done a million times. Well, not everybody's done a warm-up a million times. So how important is warming up? And then are there some basic things that someone can do to, like some basic points of performance when someone is warming up?
Yeah, for sure. So it's kind of broken up into a couple pieces. The first one is just general movement, right? So you're trying to get your body temperature up. So that would be like your light jog or getting on the bike for a little bit or whatever. So you want to elevate that body temperature a little bit. The next thing you want to do is some kind of mobility. So like we talked about before, if you are going to be doing like rotatory movements, chops and lifts, then do something.
Twisting, right?
Yeah, so then do something that gets you some rotational movement. If you are going to be doing a deadlift, that's pretty darn close to touching your toes. So do something that loosens up your hamstrings, touching your toes. So if you just do kind of like you're talking about a general regimen, you're going to miss out on some of the movement patterns that maybe you're going to be training that day.
Gotcha.
So that's another place that you can use us as PTs. Come to us, try to figure out what your warm-up should be. We work with a lot of the professional runners in the Valley, a lot of the collegiate athletes in the Valley. So we're trying to give them a more sport-specific warm-up. So that's one of the things. And then the last thing is that central nervous system activation, like we were just talking about. So your core is the center of everything. So core, hips, shoulders are what you have to have active, because all of your energy when you're doing sports, doing movement, comes through the core. That's what reserves energy for
your
use.
Linchpin.
Yeah, reserves energy for you to use and to transfer out again to a limb. So you have to do some kind of core activation within that warm up. So whether that's, again, getting your hips moving again, so some bridges or something like that, or just core activation, so dead bugs or quadruped activity, something that's going to wake that system up.
Gotcha. So if I can recap that, so you want to get your body temperature up, right? Light jog, a little jump rope, a little bike, or something like that. 2, 3, 4, 5 minutes, whatever it takes for you to kind of get the blood pumping, so to speak. And then you want to, maybe not necessarily in this order, but you want to mimic some of the movements that you're going to be doing in your workout. Maybe not fully loaded, maybe not, you're not going full bore right out the gate.
Usually those ones are body weight. Just body weight, 2 to 3 seconds.
Awesome.
Real quick.
And then there was one more part. What did I forget?
The neural activation.
Neural activation. Okay, so we want to get everything fired. So that almost kind of reminds me of like skill work, as far as like maybe it's not as difficult, but I'm really concentrating on that technique work.
Yep.
Okay.
And your core being active during it. Yep.
Okay, so core, getting your body temperature up, and mimicking some of the movements that you're going to be doing.
Right.
Okay. Maybe you and I can talk, go through what are some generally speaking good things, and to do for a warm up. Some other time we, in the gym setting, we've kind of had that general warm up, and I've kind of had an idea about what those things are supposed to activate and how they're supposed to help you out. But maybe you can tune me up so we can come up with some kind of a general warm up, that people could start with, and then use their heads to figure out, okay, well, I'm going to be doing this, this, and this. Maybe I should do, a little bit extra.
Because most people don't do their warm up because they're like, that's going to take more time. I don't feel like doing it. But if you do it correctly, you're jogging 2 minutes, you're doing your mobility piece for 2 minutes, you're doing that neural activation for 2 minutes, and then you go. So it's actually, once you actually piece out and you know what you're doing, then you go. And again, that's where physical therapists or athletic trainers can be a benefit, because we can give you those, hey, on a rotatory day, do these ones. On a straightforward or a running day, do these ones. And if you're doing frontal plane stuff, side to side stuff, do these ones. So we can really help you break out which warm-ups you really want to be doing for that day.
Oh, that makes a lot of sense. So 2018's here. I'm ready to get myself. It's time to go. I'm getting a six-pack by June. Warming up is something that's going to help me stay injury-free so that I can keep going to the gym.
For sure.
And really investing some time in activating that core, warming my body up, and mimicking some of the movements that I'm going to be doing for that day in my exercises.
Yeah, for sure. Yeah.
So I did a good quality warm up. I just had myself. So we can talk real quick. I being a part of sports, doing a lot of weightlifting, doing a lot of running, it was really about how fast I was going, how much I was doing, and how I had less focus on the quality, right? So quality versus quantity, I'd say in general, it's probably a good idea for someone to take some time and really focus on the technique of whatever it is they're doing. Right. Do you feel that's something that's going to help you stay injury-free?
Yeah, same thing. That's probably the biggest thing, honestly. Okay. So if you do any kind of strength regiment, the movement patterns that you're using within your sport, again, you can use us as resources to say, this is how it should look, this is how it shouldn't. Your coaches do a great job with that as well, but we can kind of give you that little anatomical side to it, so a little bit more specific joint to joint. Gotcha. So, and how a global movement pattern should look. Yep.
Super. What about cooling down, right? So now, good warm-up. I really focused on my technique while I was going through my workout. Is it time for chocolate milk and dinner, or would it benefit me in the long haul to spend some time cooling down? And what are some of the things you recommend as far as cooling down?
Yeah. So there's two big things. The first one that you want to do as soon as you're done is get that whole central nervous system calm down again. So exercise, sport elevates everything. It's kind of that fight or flight type response, and you're amped and you're ready, your blood's pulsing. So what you have to do after exercise is get that to calm down again. Best way to do that, lay on your back and breathe. Really? So you can Google all kinds of breathing techniques, but basically if you breathe in through your nose, out through your mouth, nice deep breaths, put on some soft music or something, and you just want to bring all of that back down to kind of a more regulatory, calm state. So that, and then mobility. So once you've gotten your blood pressure down, you've gotten your heart rate down, and you're just kind of like cooled it and relaxing. Now you got to get back into those muscles and do some mobility. You're all warm, everything's moving pretty well, so it's the perfect time to get things more flexible. So that's when you're doing foam roll, you're doing lacrosse ball, you're doing tennis ball work, you're doing some light stretching. This is the time to do now static stretching, which is longer holds and stationary holds, versus when we warmed up, that was dynamic stuff, 1 to 2 seconds, 2 to 3 seconds, and you're moving through each one very quickly. Now you're holding the muscles that are the tightest long time. Studies show that your muscle length doesn't change anything less than a minute. So if you actually want length change to actually help you have more extensibility, hold in longer than a minute.
Gotcha. So that's the time to really make some changes to my body, is after I've gotten nice and warmed up, after I've been active for a while. That's a good time to kind of go for but spending over a minute,
right?
Because anything less than that is not going to change. And even I have tight hamstrings, so this 5 seconds down there feels like 5 hours. So that's good for me to know, especially for me. Once I put a clock on something, I get my mind is very slippery, especially when I'm huffing and puffing and maybe I haven't quite cooled down yet. That I really just need to see that time go by on the clock in order to stretch myself out.
Yeah, and the big thing there is just making sure that you know what you need to stretch. So that's where, again, the PT evaluation or the screens, the injury prevention screens, are helpful, because we don't want you to stretch a muscle that's already too long. We don't want you to stretch a muscle that's irritated because of nervous tension or whatever. Let us tell you, hey, this is a muscle that is actually short and needs to be longer.
Gotcha.
We have some injuries that result from people stretching something that feels tight, but it's not a short muscle. It's just a muscle that's the central nervous system has made too active. So that's a whole different exercise. We got to get your core active and stabilize you. So that's a stability issue versus actual muscle shortness issues. So those diagnostics are what we're good at. So again, taking the time to go get a PT evaluation or do one of the screens is just helpful, so that you're not making an injury worse by stretching something you feel is tight when it's not.
Awesome. So let's say we'll backtrack again. So 2018's here. We warm up really well using those 3 points of performance there. We have a high quality movement during our workout, and now we've calmed ourselves down for this recovery piece. And if we're spending time in increasing our range of motion, this is a good time for us to do our mobility. So that way we can kind of increase our range of motion, increase our capacities for those next workouts, down the road. For a long time, for me, it was all about when I was in the gym, how hard can I go while I was in the gym? And then that paradigm really shifted as I got older and I changed out of that sporting lifestyle. It was really, how well can I recover before the next time I get in the gym? And just by taking 5, maybe 10 minutes after your workout session to stretch yourself out and to take care of your body is a good plan that can help you stay injury free and work towards that 6-pack in gym.
Yeah. Well, and it helps you with consistency, right? The hardest thing about a new exercise program is you're sore and you get to day 2 and you're like, no, I don't want to do it anymore. And then comes day 3, 4, 5 and you haven't done anything and you're like, oh, I should get back to it. And consistency is the hardest thing. So if you want to be consistent, do your warm up, do your cool down, make sure that you get everything calmed down to the point where I can work out tomorrow and I'm not too sore to do so. So it really helps with that consistency so that you reach your goals instead of like being, warm and cold about it.
Right. So you said something there. So you said soreness. Do you folks use any kind of a spectrum from because it's all uncomfortable, but from like soreness to pain to injury? For me, as I think about those terms, I don't know if we use them that way, but the soreness is kind of the thing that happens, right? I mean, it's kind of a good thing in some ways, but you kind of got to work around it a little bit. Pain is where I'm going, whoa, this is like a signal that something's not quite right here. And then injury is incapacity, like I can't do it. I can't pick up my arm. I can't, lift my knee, past my hip crease. How do you, in your line of work, use that? And is that an appropriate spectrum? And how do people tell the difference between soreness, pain, and injury?
Yeah, so we have to do that every day because we're also trying to protect our patients as we're working with them. So soreness we describe as discomfort, something that is not comfortable, but it's not making you change how you live your life. So we have soreness rules for different injuries, and different joints kind of react different ways. But the biggest rule is if you're still hurting 2 days later, you did too much. Either did too much or your movement pattern wasn't correct.
Okay.
So 2 days later, too much. A general workout, honestly, if you're doing body weight stuff, should be less than an hour. So if you're sore for more than an hour, again, a little much.
Yeah.
However, again, if you're training, if you've not been working out and 2018 is like, I'm working out, you got to expect that soreness. You got to work through that a little bit. The pain side of things is it makes you say, ouch. It's usually more of like a sharper pain or a nagging pain that won't go away. Same thing. We're saying if it doesn't go away within a week, it's pain. It's not just a discomfort anymore. You got to, something's going on.
Right.
We describe it kind of as a red flag from the brain. People with diabetes don't have feeling in their feet, so they don't get that red flag, so they get all kinds of sores and stuff because they don't have any system telling them, hey, like, this is a problem. Healthy people do have that system, and so if you don't pay attention to it, you're in the same situation they are. You're going to get more injuries. You're going to compensate so that a different joint hurts. So we really want to make sure that if you're getting that red flag, that ouch or that sharp pain, you got to pay attention to it. And you got to, again, go get treated before it becomes a bigger problem or a more global problem.
Gotcha.
And then, so last one, I didn't get to it. Injury, we say it is basically something that makes you change how you do daily life. Okay. So if I used to reach in the fridge for milk like this, and now I'm kind of like reaching like this, or if I used to go for a walk every day and now I can't walk at all, so there's something within your daily life you cannot even do anymore because of the fact that you have pain. It's the same thing. And that's when you got to get to the doc, got to go to the physical therapist, see what's going on.
Gotcha. So let's segue into this. So daily life, right? There's things that we do. There's things that we want to do. Maybe we're exercising. A lot of our working environments are not necessarily constructed to support dynamic ranges of motion and strengthened ranges. And, for example, right now we're sitting, our femurs are for the most part, parallel to the ground. And when I'm squatting, I'm working to get that, that full range of motion. And I end up being stuck in this position. So let's just talk a little bit about, we can talk a little bit about sitting. And we can also talk about what are some of the things that we can do during the day to help support and keep us healthy when we do go to exercise.
Right. So the biggest thing is so there's several, but the number one thing is setting up your space as well as you can.
Okay.
Here at SLV Health, we actually have 2 physical therapists who actually go to your workstation. They evaluate it. They recommend changes and say, hey, here's what you need to do differently. So that's a service that's awesome. It's free. And so that if you're an employee here, ask for it. We do it in the community a little bit as well. So that's number one. So that's called an ergonomic assessment. Okay. How is everything set up and is it ideal for you? So the second thing is just posture, I would say. Yeah. So phones, computers, our daily life, everything's in front of us and here.
Right here.
So 90% of what I'm doing as a physical therapist is doing the opposite of that for people. So instead of the neck drifting forward, shoulders drifting forward, arms drifting forward, we're trying to bring T-spine upright, shoulders back, neck
T-spine,
up.
I mean your thoracic, your upper back.
Right, your upper back, yeah. So basically it's working on posture as much as possible. So not only like getting the strength and mobility to do so, but also just having the awareness to say like, oh, I'm here again. Let's get back up tall. And then in addition to that, then it's movement. You got to be moving. So if you're sitting for hours at a desk, you're going to have problems. So it's whenever you have the chance, get up and move. Whenever you have the chance, do some stretches. Making sure that you're not in one posture, one position every day, because we weren't made to do that. We were made to move.
Right.
Culture has led us to desk jobs, whereas we used to be hunters-gatherers, right? We used to be out hunting animals or, doing stuff around the house.
Walking 25,000 steps a day.
Trying to get to water, wherever it was. So we were built for movement, and now these jobs have cause the opposite effect. So they're saying, so there's a book behind us called Deskbound, Standing Up to a Sitting World, and it's by Dr. Kelly Starrett, and he goes through there, he gives all kinds of recommendations to change that, but basically the point that he's making is that sitting is the new smoking.
Okay.
So now smoking, we know the dangers, we know what it causes, we know how many things it, screws up. Sitting is the same thing. Right. We're seeing increased rates of heart problems, diabetes, all kinds of weight gain. and everything that comes with that. We're seeing more orthopedic problems, so pains in different locations and stuff because people are sitting all day. So it really is important to get moving and get up as much as you can, even within your workspace.
Yeah, so well, and then while there's no guarantee, like maybe I'm just a very flexible person, there's no guarantee that sitting is going to cause me problems. However, it does increase the risk factors for those things, whether they're the chronic conditions or joint dysfunction, and those situations.
Right.
I would almost I would assert that the same idea that we took with our warm up and then that emphasis on the quality, I would liken it to our day-to-day work, as far as if we can we don't necessarily have to do more or less than nothing, but if we are increasing the quality for just a little bit of time of how we are sitting, how we are standing, and what we're doing, we could probably pick a lot of low-hanging fruit right there just by spending 5 conscious minutes every day working to sit up a little bit straighter, have a little bit more upright torso, shoulders back kind of a situation. And, you keep focusing on that and becoming aware of that. And then that 5 minutes turns into 10, turns into 15. And, just by concentrating on just how you're sitting in your chair and how you're stabilizing yourself, that could be some stuff that really supports our exercise. Would you agree with that?
Yeah, for sure.
Awesome. Let's go through, I don't know if you have a hard out that you got to go to, Corrie, but I'd like to do a fireball round where I brought some stuff, right? So this is some stuff that I have laying around my house that I've used as I've worked to understand mobility and recovery more. So these are things that I've used to mash up tissues, but and unglue stuff, and really just to help myself maintain as high a quality range of motion as I can. So I'll just hand you something, and you can tell me a little bit about it, maybe 1 or 2 things that you can do with it. This is a lacrosse ball, so it's pretty firm. Tell me about what you think about that as far as having it laying around the house.
Yeah. So again, a great mobility tool. The Supple Leopard book, again by Kelly Starrett, kind of gives you a ton of ideas with these to really make sure that you can gain the mobility you need. I'll say one of the couple of the muscles we see the most that are tight. One is pecs.
Okay.
So you can stick that right in your pec, lean against a doorway, and just kind of move your arm. So trying to get that to loosen up. Hips. So if you sit on this guy right in the middle of your butt and kind of roll around on it a little bit, that helps a ton as far as like lower body stuff. Okay. And then mid-back. So if you tape 2 of these together, or 2 tennis balls or racket balls.
The peanut.
Yeah, the peanut. So make it, usually lacrosse balls are a little too hard for the spine, but if you go tennis ball or racket ball, tape 2 of them together and then lay on it on your upper back. Your upper back is the root of all evil in so many cases. So back pain, knee pain, neck pain, I mean any pain, shoulder pain that you can think of, a lot of the times it's from T-spine because we all sit here.
Right.
So taping 2 of these together, laying on it, moving your arms a little bit, rolling side to side can do wonders.
Awesome.
So that's really helpful.
Very nice. So there's our lacrosse ball. Could be a recovery, but also could be a warm-up type of a deal. So this is a cloth-covered stretchy band here called a hip circle, and I've used this, wrapped it around my knees, and kind of walked around before I do a workout. Why is this valuable?
Yeah, so when we talked about the warm-up and we were talking about core and central nervous system activation, this is to get those glutes going. So yeah, putting it around your knees and doing some side steps, putting it around your ankles and pulling your leg to the back or to the side. Your hips are your transfer of motion and transfer of energy for almost every motion we do. So if you can get them activated, and again, they are also stabilizers of your low back. So if you're sitting in a chair all day long, guess who you need to help you out is those glutes. So it'll make you sit up a little more. So this is a great thing for activation, like we talked about in the warm-up.
And if maybe I had some of the regular stretchy band or really anything, I can even sit here and kind of push against myself to just activate those things and help myself out.
Right, especially if you have a sitting job. That's a great thing to just stick on real quick and do, and let your coworkers make fun of you because who cares?
Yeah, right. So this is called a goosebumps, but I've seen similar things called the stick, which is basically this is a medieval and colorful version of a rolling pin, and I've used this to kind of go over tissues when I'm sore. It's got these little bumps on here that kind of break stuff up, but can you tell me why this could be useful or valuable?
So same thing, we are talking about how important mobility is. I would honestly say 75% of my job is working on mobility.
Wow.
Most people move pretty well. Most people have a decent amount of strength where they're at least functional, but nobody likes to stretch or to mobilize. So this is one thing that can really help you. Again, like you said, if you don't have one of these, get your rolling pin out of your kitchen because it works in the same way. But you're just trying to make sure that you're moving muscles that don't move very well. Probably, again, if I were to give you key pieces, I would say quadriceps are probably the biggest one. So quadriceps, rolling on it like crazy, trying to really iron that out. Right? Yeah, the front of your thigh, especially the side of your thigh.
Okay.
And then calves. Everybody that comes in, again, we're saying thoracic spine is the root of a lot of evil. So are your calves.
Okay.
If you don't have full dorsiflexion, so that's your foot moving upwards, so this motion, then again, that can cause you to move differently because you walk on your feet all day. So if you can roll out your calves with this every day, then that's one thing that can really help you move more efficiently as a normal functional human should.
Gotcha.
So, yeah.
So we got a little tool, a little torture device there. Foam roller.
Yeah. So foam roller, almost same idea as this guy. This is just, you can put a little bit of body weight onto it.
Okay.
So you can lay on your belly, get after those quads again, sit on your butt on here again, roll a little bit. So a good mobility tool. We were talking about the upper back, the T-spine being a big problem. Sit down and bend backwards over this guy. So even at work, if you can stick this behind your back and do what you just did, just leaning backwards over top of it. So you can just stick that behind your chair, so scoot forward a little bit, and then just lean backwards over it a couple times a day. That could do huge things to help with your posture. So again, an easy thing, and then it doubles as a foam roller or as a rolling pin, just like we did with this guy. So you can really push into it and foam roll just like you would with that.
And even when I don't have a foam roller, I do typically have a Nalgene for me, and this is really stiff and it kind of makes you make the gristle face. But again, just something around the same shape that lets me press into it and modify my own tissues.
Yep. And because these are such, well-known tools nowadays, you can Google. I mean, use Google to your advantage. Say foam roll shoulders, and it'll give you like 5 different options. Foam roll glutes or foam roll legs or whatever. And you can just go to Google Images, and all these images will come up with ideas as to what you can foam roll.
So are there any hot spots, like if you had to list a couple resources? So we've mentioned Dr. Kelly Starrett and some of his work with Becoming a Supple Leopard and Desk Bound. What are some other resources that you recommend to folks so that they can educate themselves or understand their, either their movement or recovery or warming up a little bit more?
Man, there are so many resources because of social media now. So there is a group called Move You on Instagram. They're hilarious. And they just do short little videos about posture and movement and everything like that. So their language is a little rough, so just warning people.
Okay, maybe don't listen to it at work unless it's quiet.
Exactly, but they're a really good resource. There's a group on Facebook called Physio Tutors, and they're kind of, again, a physical therapy group that reviews some of those stuff online. There's a group called UpDoc that talks about a lot of this stuff. Recharge CrossFit Hoko. Man, you can you can type in physical therapy Instagrams or physical therapy blogs or physical therapy anything, and you can just get some great information from little videos that people are doing like daily nowadays. So trying to think, there's another one, the Prehab guys is a phenomenal one. They're out of California, and they're from USC, I think. They're all USC grads, and they have, again, a video almost at least weekly, sometimes daily, that they're giving just, again, everyday people advice as far as what posture, what good movement looks like, and then ideas for mobility and stability work. So
Gotcha. Sounds like there's lots of stuff out there. Anything that's out there that's a red flag where you should go, I don't know if I just listen to this guy.
I cannot give you, I'm really not sure about that one. Basically, what I would say is if you're not sure, come up and ask us.
Okay.
Because then we could review it for you. If you're following a new diet, or if you're following a new physical regimen, or if you're following a new group on Facebook that you like, come to us and say, hey, is there validity to this? Is this something that you guys would recommend, or is this ridiculous for me? Because the other thing that you'll find is that a lot of those groups are targeted for specific people groups. So even the screen that we do, as far as the FMS, or the functional movement screen, is for athletes. So we can't just take anybody off the street and do it, because it was built and the standards are for athletes. Same thing with any of these recommendations from blogs in different places. Usually you have to figure out what population they're talking to. So that's a tough thing. And then the SFMA, so the selective functional movement assessment that we do, is for people that are in pain, and it's for anyone. So you really have to realize that not all information is for you. So I know people love WebMD and they love diagnosing themselves, but sometimes that information is not for your population or your age or your gender or whatever, and you have to get more specific. So my advice is, if you're not sure and you want to start following something, come ask us about it. I mean, we're available and we can talk to you, and or you even. So coming to the wellness director and saying, like, here's what I'm thinking, what do you think about this? So just making sure that you're consulting someone that has a little bit of education in those things, rather than just Googling whatever. Right.
Yeah, being able to pick out, like, there's a progression to everything, and if you can best match where you're at on a spectrum, that doesn't mean that you're not going to be the champion of CrossFit one day, but it may not be, if you're coming off the couch, it may not be the best idea to go and follow their programming. They've invested a lot of time and stuff to get to where they are. So understanding where you're at on a spectrum or a progression is something that can help keep yourself healthy for 2018.
And one of the things I'll throw in there, we always recommend, if you are starting a new regimen and it's something that's a higher level than what you're used to, go to your doctor first. So go to your primary care or whoever you go to typically, get an evaluation, because we really want to make sure that you can tolerate exercise first. And lots of times those general screenings, when people go to their doctor, they find stuff that maybe they have to address before starting an exercise regimen. So really making sure that you go to the doc first. So.
Awesome. Anything else that you want to plug or talk about? I know you do your functional movement screenings, and those come up from time to time, and I'll promote those through the wellness program. Anything else, Dr. Jones?
No, I think that's it.
Awesome. Well, thank you so much for spending this time with me. I hope the folks can take this information and they can have themselves a healthy, injury-free, or if they are injured, they know how to go and get some help in 2018.
Yep. Sounds good. All right.
Thanks, Corrie.